Now it's green.
Okay.
Let us
Perfect.
know when.
So I'm going to bet we're live. So
Awesome.
Good morning. Thank you for joining us. This is the ALS Association Greater San Diego Chapter Care Services meeting. And we have a presentation today by Maxim Healthcare Services. So I'm going to turn it over to Maxim and let them make their presentation. Thank you.
Thank you. Thank you for joining us, everyone. My name is Paloma, and I am the Business Development Manager at Maxim Healthcare.
Hi, good afternoon. My name is Christy. I am also the Business Development Manager here at Maxim for our home care skilled nursing side.
Okay, so today we're going to be discussing some benefits that caregivers can use for, for anyone that's caring for a loved one who's diagnosed with ALS. And we're also going to be talking about Maxim Healthcare Services and how we can come into play. So we know that caring for a loved one with ALS can be very challenging. So one of the first things that you want to do is get some help. We know that, us as moms or wives, we tend to take care of everything, but in reality is that we need to get some help. So caregiving is a full job. It can be pretty exhausting, especially if you're unable to sleep through the night. As the disease progresses, outside caregivers will be essential to provide respite. For those that don't know what respite means, it's pretty much, getting a break. So you also want to educate yourself and set reasonable expectations. A little bit of knowledge goes a long way, especially when it comes to caring for someone with ALS. By understanding why the person you are caring for cannot move well, has muscle twitches and spasms, experiences pain and excessive drooling, and later has difficulty feeding and breathing. You can be a more proactive caregiver when you do your research and know what to expect. Pretty much, in other words, with basic knowledge of ALS, you will be able to better predict the problems your loved one, family members, friends, or partner has and can prepare well for those transitions. So how can Maxim help? As a caregiver, you also need to take care of yourself. So we understand that it can be pretty draining, your mind, your body. So in order for you to care for others, you need to be well yourself. Respite care may mean a few hours off to enjoy a movie, take a nap, go to a romantic dinner, or have coffee with a friend. So when seeking help, there are different options. For instance, you want to make sure you do your research. You're going to need support from your family members, from loved ones, anyone that's available to help. But you also want to do your research when it comes to seeking support from a home care company, just like Maxim. Maxim Home Care Services. So I oversee the unskilled care division. So we have caregivers on staff, we have personal care aides, and home health aides, CNAs. And I'm going to be discussing a little bit more about the non-medical part here at Maxim. And my colleague Christy is going to go over the skilled nursing division later on in the presentation. So unskilled services and the types of services that we offer. So what is personal care? Okay, so our qualified and compassionate caregivers work to keep you and your loved one healthy and safe by providing assistance with various personal care activities. Respite. Our respite care services enable individuals comfortably remain in their own environments while providing members a much needed respite care. Companion care. So at times we have clients who are probably alone here in San Diego and maybe have their adult children living outside a state, and we get calls to where families say, hey Paloma, do you have a provider who can come out to the home and just be a companion for my mom, dad, or whoever it is? So that's also another service that we offer in addition to personal care services. Some of our services include assistance with personal care, for example, bathing, dressing, nail filing, medication reminders, assistance with mobility, transfer assistance from bed to the wheelchair, from the wheelchair to the bathtub, to the bathroom. We can also assist with meal preparation and feedings. Again, companionship, light housekeeping, running errands, picking up prescriptions, grocery shopping, organizing any mail, any administrative paperwork, and also escorting to appointments. And one of the things that it's also super important for us is to understand our clients' needs and what they enjoy doing. So we're not just out there providing care, but we really care about our clients. So, if we have a client that has a hobby, any type of hobby, we're going to match them with a caregiver that's going to also entertain. So if we have any clients that like going to the casino, we can also accompany them to the casino. We want to make it fun and enjoyable. We know that what they're going through, what the family is going through, it can be pretty challenging. So we take that in consideration. Some of our benefits for non-medical care, pretty cost effective. So comforting solution to residing in hospital, nursing home, or assisted living community. So we can pretty much provide the care anywhere. We can follow our client to the hospital, back home, wherever the client is, we go. We also have flexible scheduling. So we're available 24 hours a day. We can also provide care during holidays, weekends, pretty much whenever we are needed. For our ALS patients, there's no hourly minimum, so that's a really good thing. A lot of other home care companies do have an hourly minimum, so that's something that that we offer for our ALS patients. We also have an on-call coordinator that's available. Do you have a question, sir?
Yeah, what's the industry standard on hourly minimum?
So there's a lot of companies, healthcare companies that require 2-hour minimum, I want to say about 4-hour minimum now.
So if I need help in the morning and in the night, I've got to buy 8 hours, even though I need maybe an hour in the morning, an hour at night.
Yes. So, here at Maxim, say for example, if your loved one if you need assistance or your loved one needs assistance with bathing, and you just need Maxim to go in for that, we can do that. Even if it takes 2 hours. So that's something that we can offer. We have also an on-call coordinator. So we're available 24/7. When you call in, you're always going to speak to a person. So that's always a good thing. Flexible payment options. So speaking in regards to payments, and my colleague Christy is going to touch a little bit more about that. But for non-medical services, there are some options. If your loved one has a long-term care insurance policy, we can go ahead and take that. And then you also have the option to pay out of pocket for our services as well. We also do free in-home consultations, what we also call an assessment. So, going back to being prepared and doing your research, you don't have to start services with us right away. We can always come out to the home, do a consultation, get you ready for when the need comes. So that's always a good thing, and that's free. We don't charge for that. Okay, any questions?
So I think that last point's like really important. People may not be ready, but to go through what I'm going to refer to as the intake process and have those interactions with a company like yours, I think helps everybody understand the care plan
Yes.
that needs to be in place now, with or without assistance. Care plan is the care
Exactly.
plan.
Yes, and the care plan can always change. So we can continue to keep going back out there as needed. And I'm also going to be touching on that a little bit on the next slides. So starting services with Maxim. So once you have chosen Maxim as your home care agency of choice, one of our managers will come out to your home, hospital, rehab center, other facility to conduct the in-home consultation. All findings and requests are then incorporated into our approved plan of services, which we also call a plan of care, including comparison of your preferences to matching a caregiver. At Maxim, we know that no two patients are the same. Therefore, we tailor our home care services on a case-by-case basis, and we'll work with your family to develop a plan of care that meets individual needs. So touching on that plan of care and meeting with the family to better understand the needs, that's very important for us. We like to take our time and ask a lot of questions, and we prefer to have, the family there, because what we do after we do the plan of care, the consultation, we go back to our team back in the office and we brainstorm. So that's when we start, matching the caregiver with the family. And one of the pretty cool things that we offer that a lot of home care companies don't, it's meet and greets with our caregivers and the families. To me, I feel like that's very important and very personal. We want to make sure that we're just not placing any caregiver into a home that may not be that perfect match. So I can have my best caregiver, but that best caregiver is not going to be the perfect fit for every family. So it's very important for us.
They might be a Dodgers fan,
Yes.
These are things you got to think
Yeah,
about.
it's very important.
Yeah, so we definitely want to deliver. And if that provider, it's not a good fit, I always encourage our families, speak up. You don't have to go with the first
nursing flow sheet. So if you track progression or trends, or if you left for the day and were to come back, you have a full report of what happened throughout the day. All nurses must follow the doctor's orders and a plan of care that is created by our RN clinical supervisor. So the care is continuous. There's continuity of care. They have to do everything that's ordered by the doctor. So they will never give meds or even put on chapstick or sunscreen if it's not an order by the doctor. They can help order supplies as they get low, just really manage that care, and then also equipment management. So if there is a ventilator in the home or other equipment, they can manage that. How to qualify for private duty nursing. This has to be approved by the doctor. The doctor has to say that there is a skilled need for private duty nursing. And a lot of times this is in conjunction with the insurance. Typically what qualifies somebody would be, if they had oxygen, G-tube, trach, or ventilator for sure qualifies them. However, we've seen all sorts of circumstances to get them qualified for skilled nursing care, so we're open to exploring all options and helping the families explore these options as well. Insurance approval, for the most part, we work with insurances to get these benefits approved and paid for, but we also do private pay. So we will work with insurance companies to get the authorization. We'll submit for the authorization and continue submitting for it. And as long as insurance approves for the certain number of hours, and that's what we staff for. But there is always flexibility to that depending on what the family is looking for.
So question,
Yes.
does the insurance, does it cover caregiver also, or only the private duty nursing?
Only private duty nursing for us in our division. And so we work with, and I'll touch on that in the next few slides, we work with multiple insurances. Pretty much we're contracted with any of them, and it just depends on what they have covered in their benefit. And then the last thing is how to qualify for skilled nursing care is suitable home environment. We want to make sure that it's safe for the nurses and the patient to be at home. Yes, question?
But for private duty nursing versus your side of it,
Yes.
does the insurance ever cover both of those at the same time?
Gotcha. So for us, our insurance only covers for skilled nursing, private duty nursing.
Yeah, so for our services on non-medical care, you will have the option to pay either paying out of pocket private pay, or if you have a long-term care insurance policy, like for example MetLife, John Hancock, and those long-term care insurance that you bought and now you want to use, you can go ahead and use that. Most of the long-term care insurance policies do have an elimination period, so it's important to know your insurance.
What's that mean? They have to wait 90 or 180
Yeah,
days?
so at times, it all depends.
Where they're paying
Yes,
for
and they
themselves?
pay out of pocket. So if you have an elimination period that's 90 days, you will have to pay out of pocket private pay for those 90 days until the, until it kicks in. Yes, and then it's important to understand how many hours and what the spending limit is per week on those type of insurances.
Yeah. But each case is different, and so we understand that each case, each plan is different, and we really take that off of the families to look and investigate what the plan is. We can look into that for them. So yes.
I guess just to really back it up, because I know how tricky they can be.
Yes.
So if you had a private duty nurse, so if we were at a point, they said, yes, you need a nurse, say
Yes.
40 hours a week, whatever
Yes.
that is.
Yes.
Would that nurse also cover these other, to doctor's appointments and things like
Yes,
that? during that?
absolutely.
So that private nurse would double duty as a caregiver during her his or her scheduled shift.
Yes, the nurse can
Okay.
take over the care that a caregiver would do. There are some things that they don't do, but for the most part, it's like going to doctor's appointments, preparing meals, day-to-day activities, making sure that the area is clean, the nurses
Yeah,
can
okay.
take care of. Yeah,
Yeah.
for sure. A lot of times when we do partner up though is when, say, if there is lifting, a lot of lifting at a night shift, we may have a caregiver come for a few hours to help
Yes.
with that routine, and then they may leave and the nurse just continues care.
Yes.
Okay, so I'm going to let you go on, but one of the things I'm looking for is to have it crystal clear for the patient, the loved ones, the family members, and the relative that comes in from New York for a week and questions everything that's going on.
Right.
You know, I'm to the point in some situations where we've actually made a poster size of the care plan. And look, if
Yes.
it's on this poster, that's what they do. If
Yes.
it's not on the poster and you ask for it, they're not going to do it.
Yes.
So if you, I'll let you continue.
Yes, yes, absolutely. Okay, so our referral and onboarding process, this is a time frame that we can work with the family. I know the goal is to be proactive about care, but that doesn't mean right now the family member may need in-home skilled nursing care. It could be a few months down the line. It could be 2 weeks from now. And so what we do is the office receives a referral. We will discuss the clinical needs, staffing needs, so the family needs overnight shifts, day shifts. We'll discuss that so that we can look into what available nurses we have. Insurance information, what insurance are we working with? Are we doing private pay? What kind of authorization do we need to obtain? Also, so next thing is we do an insurance eligibility check just to make sure we have the hours to use. We will do a home visit with a clinician and myself just to get to know the family so that we know what kind of nurses to send out to the home. We then come back to the team, discuss with the team the needs of the family, and then we set up meet and greets, just like Companion. We have nurses come out to meet the family and for the family to meet the nurse. We understand that in the home, it is a very private setting. You are having somebody in your home, so we want to make sure that it is a good fit. We then coordinate the schedule with the family and confirm with all the nurses, hey, this is what you're working, the meet and greets went well, this is what the schedule looks like. Then we will proceed with the case open. From there, we do the case open, the nurse starts working their regular shifts, and then our RN clinical supervisors will do monthly or bi-monthly visits to ensure that care is going well and that, you know, everything is working out. Okay, I'm going to talk about insurance coverage. So typically in our division, we work with insurance and private duty nursing needs to be something that's covered by either their primary or secondary insurance. The reason why I say that is some people have, say, a certain type of commercial insurance as a primary, but then secondary they have Medi-Cal. And if the primary does not approve of skilled nursing care, then we kind of bump it to Medi-Cal. And if the client doesn't have insurance that covers private duty nursing, we help the family explore different options, whether that be appealing for that primary insurance and, you know, providing all the clinical information to the insurance company. We work through the whole appeals process to see if they will approve of private duty nursing because of medical necessity. If that doesn't work, we also assist the family in applying to Medi-Cal or getting onto an insurance that will authorize for this care. A lot of insurances that we work with the VA often, Medi-Cal, we work with TRICARE Echo for active military, we have workers' comp, and we have, you know, private commercial insurances. As a part of proactively planning for the future, we're happy to look at any insurance plans to help the family see if this is an option for them and if it is a covered benefit. We also have clinical oversight, and so our RN clinical supervisors create a whole plan of care, and that is signed by the doctor. Orders are sent to the doctor, and so we really coordinate care with all specialties, primary care doctors, in-home skilled nursing care, PT, OT, ST, kind of help tie the whole picture together. We make sure that there's care coordination, and that all nurses that come out in the home are competent in their skills. Anybody that's working on a patient one-on-one will be fully trained and able to work on those skills. We do annual competency checks with our RN clinical supervisor. Every year they have to do compliance modules. Here at Maxim, we are extremely compliant, and so everybody that we send out, they're fully trained. If we ever were to do training, it's always nurse to nurse in the home, and it's not like nurse trains with a family member on how to use a ventilator. So clinical training, we have a home mechanical ventilation training program that we've created with Johns Hopkins University. All of our nurses that work on ventilators have to go through this training. They have to go through a ventilator training class that we have monthly, and then they have to do one-on-one training in the home. So here's a video.
Resuscitator, cuff trach, cannula, pulse oximeter, SGAs are just some of the terms and equipment that you will encounter when working with a ventilated patient. After a ventilated patient is stable enough to come home from the hospital, there's a need to set up and maintain a variety of complicated equipment. This can be very difficult for a family to maintain, but a nurse with proper training can assist the family and increase the likelihood of successful outcomes. This is why Maxim Healthcare Services, a leading provider of care for trach and ventilator patients, in partnership with Johns Hopkins School of Nursing, has developed an innovative online home mechanical ventilation, or HMV, training module. This new module is interactive and designed to prepare nurses for their in-person competency evaluation. This training module allows an HMV nurse to review content in a dynamic, low-pressure environment.
Johns Hopkins University School of Nursing and Maxim Healthcare share the same passion and desire to ensure that our patients receive optimal care and achieve the best outcomes.
As a potential patient, as a parent of a child that is trach and ventilator dependent, or even as a referral source, we know that you want to have the most competent nurse in the home.
This 60-minute course can be taken on a personal computer at the nurse's convenience. After completing the training, caregivers possess the skills and confidence to better care for their patients.
I like the fact that it times you out, that it actually puts you in a real life scenario. It really gives you all the tools, it gives you all the information, the plan of care, it gives you all the patient's background, and then from there you're going to go in and you're going to assess a situation.
It provides the nurses with a leg up in their careers to have a better understanding and increase their skills in the home.
Maxim's online HMV training module is already making a positive change in the lives of patients, the patients' families, and caregivers.
I'm so excited about this training module and the confidence that it's going to build with our nurses who are taking care of the trach and ventilator patient in the home and managing these emergency situations. And I'm equally thrilled about our partnership with Johns Hopkins School of Nursing.
We hope that this education program will provide Maxim nurses with the knowledge, skills, and competencies to be able to react and respond to a deteriorating patient.
Take your training and your career to the next level by becoming a Maxim nurse. Learn more at info.maximhealthcare.com/nurses.
Okay. And so for us, aiding ALS patients, we want to make sure we're here to help them proactively plan for their future, and as changes happen with the diagnosis, we're here to just be that support. We are very involved in the community, and so if anybody needs help with Medi-Cal enrollment, I'm here to be a resource for that. And also with that in-home support services, Medi-Cal through the HCBA waiver, here to just help with insurance or benefit verification, private insurance appeals, and then we are connected with a lot of local programs here in San Diego, and so just happy to be a resource for families. This is just a snapshot of the areas of service here in Southern California. We have offices throughout Southern California. We have one up in Carlsbad, Temecula, here in San Diego, and so we cover a wide range of areas.
Yes, so as we know, caring for someone with ALS is difficult and energy consuming, both physically and mentally. But while there are many trying bumps along the way, be assured that there will also be uplifting, soulful moments. In the end, your care, your attention, and your presence are enough. So be kind to yourself and remember to be mindful of your own needs. You can't forget about yourself. You have to be good in order to care for others. The video that we are going to play next, this is our Caregiver of the Year of 2018. I have been with Maxim for about 8 years now, and I can say that what stands out in Maxim compared to other home care companies, it's the people. And you can see yourself in this video. Our nurse in this video, she was married to her husband was battling ALS. Unfortunately, he passed. Right after he passed, she started providing care for one of her clients also diagnosed with ALS. So hope you enjoy the video.
My office manager, Greg, said that they had a patient with ALS, and it was kind of difficult for them to staff because ALS is a tough disease. And I told him that my husband had passed from ALS.
A lot of it had to deal with timing, where Sue was in her life, and what had happened to her, and then us having Mr. Cole as a patient and needing someone of Sue's caliber to be, over here taking care of him.
My friends and family thought I was right out of my mind. It hadn't even been a year since Andy passed, but I felt like it was something I needed to do.
We were lucky enough to find Sue that checked every box, and as soon as she met the family, it became a match made in heaven.
Sue actually has a conversation with him. She asks him what his needs are, what he wants, and actually treats him like a person, not just like a patient laying in a bed.
We were talking one day and he was saying how terrible the disease is, and he said to me, "What did Andy die of?" And I just burst out crying. I said ALS, and then the tears started on him, and we both sat in his room and cried for a few minutes, and then we were fine.
I think she understands the disease a lot more because, she lived through it, so she does understand what I'm going through.
Helping Andy die with dignity. I know the amount of patience it takes to have a loved one with this disease. With some diseases, you might get a little better for a little while, peaks and valleys. There's no peak with ALS. It's a downward decline every single day.
Sue's special because she is always reliable. She brings positivity and that compassion for the patient. When the families get to meet her, get to know her, they know my loved one is being taken care of with top-notch care.
She's an awesome person, and she's so happy and positive, and she makes my life a lot easier. She makes the mountain of stress just kind of melt away. We just love her so much.
She takes the best care of me and my family. I love her for doing what she does.
It was absolutely destiny that I'm here in Virginia, and I say that to Rick, that he saved me. He's the reason I'm in Virginia, and it's done me a world of good.
Okay, so I hope everyone found this presentation informative. Again, my name is Paloma, and I'm with Maxim Healthcare, my colleague.
And I'm Christy. We're happy to be here and be a resource for anybody. Thank you.
So a couple of questions.
Yes.
What are some of the requests you get that are almost never supported by doctor's orders? Or, and then how you, I mean, you have to work through those issues. You have a few war stories to share, or just for an example? One that I run into all the time is people want a massage. You know, it's normally not on their care plan. So that's something they need to go hire a masseuse who would come to their home and do it. Do you run into that where people are asking for things that aren't on the care plan frequently, or?
For companion for non-medical, it's definitely, because we don't go based off doctor's orders, we go based on the client's needs and the family. You know, if we have a caregiver that's comfortable and, you know, open for that, but that's something that we can definitely do. The biggest thing with companion is the medication piece, like the administering any form of medications or medicated lotions. So that will probably be a red flag if it requires any type of cream that we need to use and it's medicated while, you know, if the client is requesting a massage, that's something that for the non-medical piece, we won't be able to do.
It's always best to discuss it up front.
Yes.
Yes.
And then and have people understand, hey, if you ask for something that's not on the care plan, there's a process. So everybody can regroup and make sure this is something that we can move. It's not going to be at 4 o'clock you're going to get what you want.
Yes, for sure. And especially on the skilled nursing side, all of our nurses have to follow doctor's orders, even if it's, like I said, chapstick, putting on chapstick or sunscreen. If it's not a doctor's order, they can't do it. If there's a family member in the home, they can do whatever they would like, but nurses have to follow a plan of care, their plan of care. And so it is a little bit of a process. If there needs to be certain things, we do request for a doctor's order, and then it may be the next shift they'll be able to do that. Yeah.
The doctor can say, go ahead and massage the legs.
I mean, the doctors, yes. I mean, if the doctor says it's as a part of physical therapy, you know, nurses can help reinforce that after the physical therapist leaves, then that could be a part of the plan of care. Okay. Yeah.
And those rules are in place to protect
Right. Yes.
Exactly.
both parties.
Yes, absolutely.
Are nurses able to do things away from the patient at all? Like, can they go and pick up the patient from an appointment, or could they go to the grocery store and pick up supplies?
So for on our skilled nursing care end, the nurse always has to be with the patient. They have to be in the same room because the nurse has to monitor the patient's care and change of condition. If the nurse goes, it's just not allowed under state law for them to go anywhere without the patient.
Yes, and for companion, if it's in the plan of care, transportation, running errands, we can definitely do that. If we need to pick up groceries, prescriptions, we can do that.
Now, would a caregiver?
Yeah.
For our listening audience at home,
So would a caregiver could they do massage?
Yeah.
That kind of
It's
stuff,
not
so-
going to be a professional massage, of
Yeah, yeah,
course,
yeah,
but
just
yeah, like,
because there is a lot of comfort in that, like Keith was
yes.
saying, it's when
As
somebody's
long as we're not
not very
administering
mobile.
any creams, applying any medicated
No
creams, we
medicated
should be fine.
creams.
We
Okay.
should be fine.
So any basic care. Yeah.
Yes.
Okay.
Yes.
So what is the difference in price structure between a caregiver and
So
nursing
for
care?
companion, we actually just for ALS clients, we have a discounted rate of $27 an hour, and this is something that we just offer for ALS patients. If, say for example, if it's someone else, our rates do vary, anything from $29 to $33 an hour.
And for the skilled nursing side, for the most part, work through insurance. If it is private pay, we really have to do an assessment of the patient first to kind of tell what that range will be.
So do you have a lot of Medicare patients? I know that's a tough one because they're kind of older and you don't.
Yeah, typically we access their Medi-Cal benefit through either like a waiver or something like that, and as long as they approve of skilled nursing care, then we can use that benefit.
How does that work if that Medi-Cal is versus? I'm just thinking, my husband's on Medicare.
Yes.
Because he's of that age, but how would that apply? Then Medi-Cal wouldn't be a part of that. So I guess that's my question.
I believe it's under all one umbrella, and so there are different plans
Okay.
with each, and so even within Medicare, they have their own different plans, and so if you needed help looking into the benefit for that, I can definitely help with that. Yeah.
You know, one of the things I'll share that our families have experienced. I mean, I have people in Rancho Santa Fe with tremendous assets on Medicare, Medi-Cal. Okay, there are ways within the way the law is written. It's designed to protect families and their assets. So the patient is isolated. There's a trust structure that's set up by professionals who do this, and then that person is isolated and can get the benefits. It doesn't happen overnight. It's a lot of planning. Setting up a trust can be time consuming, but when everything's in order, this can happen.
Right.
And it's legal. It's the way it was written by Congress. If you go back to the 70s, you had married couples getting divorced because they were being wiped out by the medical needs of one party or the other. And Congress said, well, that's not right. You shouldn't have to get divorced to protect all your assets. So they rewrote the law, and with a proper trust arrangement and so forth, you can access your benefits.
Yep.
Yeah.
And we have a webinar on that from last year. So.
Nice.
Anything else?
Sure.
Okay.
Thank you, Maxim, so much.
Thank you.
Thank you for having us.
And a big thank you to Lifepro Financial Services for providing us this beautiful conference room and the IT technology to allow us to webcast. And that concludes our Care Services meeting for June 2019. Thank you for joining us.
Thank you.
So it's going to be live.
Okay.